Hi, I'm Amy from the Australasian Leadership Academy, and I'd like to introduce one of our respected partners, Dr Stewart Hase. Dr Hase is partnering with ALA to deliver a number of courses, as well as executive and management coaching. Stewart is a psychologist who has extensive experience as a therapist, academic, writer, management coach, and organisational consultant. Stewart also facilitates workshops, and two of his most popular courses are What Do I Say Next?, which provides mental health first aid skills, and the other is the Neuroscience of Leadership program. So thanks for joining me via Zoom today, Stewart. Yeah, I'm really interested firstly in your Frontline Help in Mental Health program. What do I say next? Can you give us an overview regarding who has the course been designed for, and some of the skills and topics in that program?
Yeah, sure. The mental health first aid course in lots of ways mirrors the physical first aid course, and obviously mental health has been very topical, or more topical, over the last few years, and particularly the stigma around mental health has declined, and we've had people who are well known coming out and talking about their mental health problems. So it seemed timely that one of the things that we could do is try to do as you do in normal first aid, and that is try to provide people with skills so that they can help people in the community. And they might be relatives, they might be friends, or they might just be people that they meet as part of their community work. And of course, people who are in the workplace. So that's why the course was designed, so that to give people that kind of first aid kind of approach to dealing with psychological problems.
Mm-hmm. Okay, fantastic. So now with the type of restrictions around group-based training and training in the workplace, I know that you've facilitated many workshops face-to-face and within large organisations. With that type of interactive workshop model, can you just describe how the new online model of this program, what that would look like for a participant?
Yeah, sure. We live in a changing world, don't we?
Yeah, absolutely.
It was originally, or it is still, a 2-day face-to-face program, usually run over two weekends. So you get a chance to do some practice and thinking in between sessions, or 2 weekdays if it was a workplace. And of course, highly interactive, lots of videos, lots of activities, and the person, spending a lot of time working with each other. Now, given that we're going to do it online, obviously that's going to have to change a little bit. And so what it's going to look like is the person will be able to access the content online and be able to see the workbook and other materials, as well as access videos, which are a large part of the course. And the videos show how to actually deal with people who have particular problems and issues. Okay. And that will be, and included in that will be 2 webinars, which will be interactive. And we'll ask people to log on using Zoom or some other platform, where we'll be able to talk about issues, and also people can ask questions about the workbook and activities that they're completing. If people want accreditation for the course, it's not mandatory, but if they'd like accreditation, then they'll need to do some assessment items. Those assessments basically won't change from the face-to-face program.
Okay, that's fantastic. Yeah, it sounds like it's still very interactive and there's a lot of variety there. Fantastic. Well, thank you so much for your time today, Stewart, to give us an overview of that program. For more information, any participant can jump onto the Australasian Leadership Academy. The program structure is up there and the inclusions. And would also like to catch up with you too, Stewart, on the other popular program of yours, the Neuroscience of Leadership. So it'd be great to touch base with you again next week and hear about what that program details as well.
Absolutely, no problem. Thanks for the opportunity.
Excellent.
To talk about.
Thanks so much for your time today. Appreciate it.